The spine is a crucial structure divided into the cervical, thoracic, lumbar, sacrum, and coccyx regions, with intervertebral discs acting as shock absorbers. Issues like degenerative disc disease, bulging discs, and herniated discs can cause debilitating back pain, sciatica, or neuropathy due to nerve root compression. The nucleus pulposus pushes against the annulus fibrosus, causing disc deformation. The nucleus pushes through a tear in the annulus, irritating nearby nerve roots. The Drx9000 offers a non-surgical, drug-free approach to treating these conditions. It targets specific disc levels and applies precise, controlled decompression to relieve nerve pressure, reduce pain, and restore function. By utilizing a logarithmic pulling curve, the Drx9000 creates negative pressure within the disc, drawing the nucleus back to the center. This vacuum effect also improves nutrient and fluid exchange, restoring disc health and increasing disc height in cases of degeneration. Clinical studies, including those from Mayo Clinic and Johns Hopkins, show an 88 to 90% success rate for patients treated with Drx9000. Results are supported by MRI evidence showing reduced disc protrusion and improved disc integrity. Treatments are comfortable, lasting around 30 minutes. The system self-adjusts 13 times per second, ensuring smooth and precise decompression tailored to each patient's needs. Provides an effective alternative to surgery for low back pain, sciatica, and herniated discs. Addresses pain at its source, enabling patients to return to their daily activities with reduced comfort and improved mobility.